morning, viewers. Welcome to our channel. Your health are concerned. Today, we're having a very interesting topic that says poor menstrual hygiene. Here with me, I have a girl speaker. Please, my guest name, please introduce yourself to our viewers.
Hello, good morning. My name is Vincent, and I'm a pharmacist in Access Pharmacy. So I'm here to give a small lecture just to throw small light on what menstruation is and how to go about menstrual hygiene. Thank you.
Okay, viewers, as we all know, menstrual hygiene is something that is common globally, and there is way people think and do about it, which we are bringing to your table this morning to know how to go about it. And here, my guest is going to be doing a justice to that. Okay, Vincent, the first question I have here with me is that how often should a sanitary pad be changed? Because some people think that wearing one sanitary pad, as far as they don't get stain, like it's okay. I want our viewers to know that. Please throw more light on that so that they will know when and how often sanitary pad should be changed.
Okay, so thank you for that wonderful question. Well, first of all, let me just say what menstruation is. So menstruation, for us to know, it happens only in women and ladies in childbearing age. So this process starts from age 13. In some people, it starts from age 12. You know. So what exactly is menstruation? Menstruation is when the uterus in a female sheds, gives off blood, gives off mucus. It's actually a monthly routine. Whenever some ladies don't see their period, it's cause for alarm in them. You understand? So in this process, a lot of hormones come into play. We have progesterone, we have the estrogen, we have follicular stimulating hormones, we have the luteinizing hormones. You understand? So let me start from the menstruation itself. So there are actually four cycles. So there are four processes in menstruation, which takes about 21 to 35 days on average. But generally in women it's 28 days. So the first is the menstruation itself, which happens from day one to day five. So what happens in this process? In this process, the progesterone and estrogen levels are low, you know. So what happens then? The uterus begins to shed everything, all the hormones begin to drop, and then it comes out in form of blood, in form of mucus, and that's what everyone sees as menses. When girls tell you, "Oh, I'm seeing drops of blood," that's what constitutes um in that blood. You understand? So it takes an average of 1 to 5 days in women. So that's the first stage of menstruation. So the second stage is what they call the follicular stage. So in this stage, there is a hormone that there is a gland in the brain called pituitary gland. So this actually secretes what they call follicular stimulating hormone. So what does this hormone do? It actually stimulates the ovaries to release eggs. Actually, it causes maturation of eggs in the ovaries. So as everything is getting mature at the same time, there's usually a particular egg that grows above and beyond every other one in the ovaries. So that stage is what we call the follicular stage. So after the follicular stage, we have the the ovulation stage, which happens around day 14. So what happens in um, this stage? This is when I talked about in follicular stage. I talked about the fact that an egg matures more than every other one. So in this stage, that particular egg that matures before every other one now begins to go down from the ovaries to the fallopian tube. You understand? So in this process now, the estrogen levels are high. Is causing thickening of the uterus, preparing it for possible fertilization. You understand? Yes. So after this ovulation stage, we now have the luteal stage, that's the luteal phase. So what happens in this phase? You know that particular egg I talked about that comes down from the ovaries into the fallopian tube. So this particular egg now turns into what they call the corpus luteum. Now this corpus luteum actually releases the hormone called progesterone. So usually when you check, when if you do a hormonal profiling in females and they are in this stage, you see that the estrogen levels are high, the progesterone levels are high. You understand? So it's more like preparing the female for possible fertilization. You understand? So after this stage, if fertilization does not occur, then everything disintegrates. All the hormones drop, the uterus lining sheds, and everything comes out as blood, or we know as menses. So we're now starting from the first stage, which is the menstrual phase. Yes. So so back to your question, how often do should we change our
Sanitary.
sanitary pads? So I've seen cases whereby a lot of women wear one sanitary pad for 24 hours, which is not supposed to be so. The sanitary pad should be changed, be it tampons or pads, it should be changed every 6 hours. This way, we prevent bacterial overload. You know, there's a lot of bacterial activities in that light, and also it tends to prevent what they call toxic shock syndrome. You understand? So yeah, so this is the reason why it's meant to be changed every 6 hours.
I hope our viewers are taking note to the importance of changing their pad. For those of you that think that there is some pad or something that is safe that you can use up to 12 or 24 hours, I hope you are taking note of that. Okay, going back to the next question. And the next question is how often, because some people believe that the pad is clean, they look at their hand, they see that it's clean. Is there, they don't feel that there is need for washing of hands after change as far as they don't have stain on them. Because some people when they go outside, maybe to an environment, maybe it's not your home, they just want to quickly change their pad. Maybe there is no water running there, they just do what they want to do and they just come outside and feel free to do. So how important is that washing of hands?
Washing of hands is very important. You understand? Normally, you touch things with your hands. You understand? So if you don't wash your hand, you tend to carry the germs from items that you've touched. Yeah, placing it in this area, you'll be trying to change the pad and all of that. It's going to cause infection in that area. Apart from that, if you're trying to change the pad, blood stains can touch your hand. You use those same blood stains to touch every area, which is really not hygienic. You know, so you're causing harm to yourself, you're causing harm to the environment, causing harm to every other person that might come in contact with those same surfaces that you've touched. Yeah, so this is the reason why it's important to always wash your hand before and after changing the pads.
Thank you so much for listening. Okay, the last question on this particular section is going to be: is it safe to use rag, tissue paper, rags as a substitute for pads? Because I know there's some people that make use of clothes. Some people make use of tissue. Some even went ahead and make use of um cotton wools for them for as a pad. So how bad is that?
Okay, so for the aspect of using tissue, yes, I know some ladies actually do that, but you know, tissue, it has it's poorly, it has a poor absorption rate. Yeah, so it doesn't properly absorb. That's why most of the times if you dampen tissue, it begins to disintegrate. It doesn't have that holding capacity. You understand? So if you're using tissue, you will just be making a mess of everything. It doesn't have the capacity to hold in the blood for a very long period of time. And then the fact about using rags is no, because you know that we use rags to clean surfaces, so you can't use something that you've used to clean maybe a dirty surface to now wrap it in your private area. That's causing a lot of harm to yourself.
No, concerning that, let me come in there. When I mean rat, does not mean it's something that you use for another different thing. There is a particular set of people, they get a new clothes, they just cut it in different shape for that particular purpose. So they mainly use it as pads. So it's not like it's not like any pieces. But instead of getting pads, they prefer using clothes, cutting into a shape to use for alternative. So it's not like it's a random clothes that they just pick and use.
Okay, yeah, it's not a question now. So, like I said before, like in terms of using tissue, those other clothes that they use don't have that absorbing capacity. It doesn't have. If you watch Always Ultra, one thing they advertise about is their capacity, their parts capacity to hold and to absorb, that clothes for a long period of time. So all those clothes that women tend to use, they don't have that capacity to absorb. That's why if they use those things, now they tend to get frequent stains. You understand? They tend to get frequent stains. And then using those clothes is not also really hygienic because all these pads that we have, they have certain certain kinds of antiseptics. It might not be really the antiseptic that we use, but there are processes to just keep the pad and the environment clean. You understand, free from bacterial overload for that period of time when it's going to go on. You understand? So ordinary clothes don't have those capacities. You understand? So that's why it's not advisable to use tissue and other clothes. Yes.
Let's because I think this is the main place we have to do it. So I know some people when they want to use the cotton wool, we are going to talk about the health issues and advantage of that. But please, can you throw more light for ladies that make use of the cotton wool? Because in my own sense, I don't know why if there is need for you to have your private parts or vagina blocked for the your for the blood not to flow. I think the people that is making sanitary pad they will have provide something like that. But some ladies they think for it not to flow by blocking it is good for them. And when we talked about sanitary rats and all these things continue to respond that day, what do you have to say about it blocking? Not allowing the blood to change out, like blocking it and maybe they can now carry it like let's say 6 hours. They will now release the cotton wool and the blood will flow. What do you have to say about
Okay. The aspect of using cotton wool to block, that process is not supposed to be blocked actually. In fact, if for women that use tampons, the way tampons work, once they insert it into their vagina, it tends to absorb the blood. You understand? Using cotton wool, cotton wool is actually going to block that process, and blocking that process is going to create a bacterial overload and can cause infections like pelvic inflammatory diseases and every other infection relating to urinary tracts, all of that. So I don't advise women to use cotton wool to block that area. It's meant to flow out. You understand? So
thank you so much for throwing more light to that. Moving on to our next question, we're going to be talking about how to dispose back. Because you go around in some area, you seeing sanitary pad on the way, like something that is meant to be kept secret, that is meant to be kept where you go on the road, you see people, they don't even care, they just throw it anyhow. You see people in some house, just like early morning, you see them chatting and you suck away, it block when they try throwing it, you find out that it's sanitary pad that is there. So what is the safest way to dispose all this pad?
okay, so like you said, it's not meant to be disposed in a particular space. It's not meant to be flushed because it can block the septic tank. It can cause overflowing of toilets. Imagine someone wants to flush a toilet now, and let's say there are fecal matters in the toilet, and then when you flush, everything is pouring out. It's an eyesore. You understand? So how is it meant to be disposed? Either you use an incinerator, that is, it's dumped into an incinerator and it's incinerated, you understand, or you tie it in a very in a proper nylon and then dispose in an enclosed bin. You understand? It's not meant to be. Because if you throw it outside, tend to experience flies, tend to experience rodents and all of that, and it's polluting the environment. So those are the proper ways of disposing sanitary pads. Yes.
I hope our viewers are taking note of these few points on how to dispose their pad very well so that the environment will be clean and healthy for everyone. So, and the next question, we are talking about infection and health risk of poor menstrual hygiene. The question I have here is, what are common signs of reproductive tract infection caused by poor menstrual
Okay. So like I said earlier, if you wear sanitary pads for a very long period of time, it can cause bacterial overload. You understand? So the common reproductive tract infections that are there are discharge. It could be a color, a yellowish discharge. It could be a brownish discharge. It could be a whitish discharge. And there is usually itching alongside. Then there is what they call, if it stays for a very long period of time, it can cause pelvic inflammatory disease. Then in the long run, it can cause, if not properly treated, it can also cause infertility. So those are the signs.
Okay, because according to what you just said now, I don't think that it's 50%. Let me know exaggerate by saying it. I think like 50% of the ladies will be having these issues and they may not know that it's due to poor health, menstrual hygiene that they keep having this. And you see those people, they keep coming. So like I'm having an infection and you give them the medication, they take it. The next month they repeat the same thing. What do you think is the best way to educate them on that? Because as you're saying it now, I guess I'm having this knowledge that for some people that is having infection, they may be having the infection due to poor menstrual cycle, and to them they are not aware, or they keep blaming it on I use the public toilet, I did this, I think this is where it's coming from, and they keep getting treatment because they keep repeating the same cycle always. When something is poor and you are not doing anything about it, it's meant to be repetition of it. So what advice, or what do you think, is there a way that people will create awareness so that even before they go about saying I have infection, because you cannot, somebody may not just come in to get an infection drug and asking the person, how was your menstrual hygiene? Is it poor or clean? Something like that can be said to a customer. Person will find it very offensive. So how do we relate this matter to them, to the public, for them to know that they can, through very poor menstrual hygiene, cause some infection that they keep on treating and treating over the time, which is not meant to be so. How do we relate this to the public? To them to know?
Okay, thank you very much for that question. So usually when a lady comes into the pharmacy to complain that she has an infection, she's thinking with the public toilets and all of that. That's what she thinks. You understand? So you have to now go for that to ask, okay, when did these symptoms start? You understand? What kind of discharge do you experience? Because it's possible that it's due to the fact that they have poor menstrual hygiene that they are seeing all those symptoms. And if it's a lady that has begun to have sexual intercourse with the partner, she can actually pass this infection to the partner, while the partner can also then reinfect them. So now they tend to tell you that, oh, it's possible that maybe their partner was not faithful. Maybe he went out there, got an infection, and then came back to give it to me, something like that. You understand? So you tend to reflect them. You ask them, okay, oh, when did you notice this? What kind of toilets do you use? And then you now begin to ask them, oh, your previous menstruation, how did you go about this? Let's say you ask them, okay, how long do you normally wear your sanitary pads? just educate them, tell them what they're supposed to know, because most of them don't even know that, oh, they're supposed to change your pad every 6 hours. You understand? Most of them wear their pads for um 24 hours and all of that. So we as health professionals, are meant to create awareness, create awareness, make public announcements through videos and campaigns, on proper menstrual hygiene. So that way we can actually combat these infections that people tend to complain of.
Thank you so much for that. I know that our viewers have learned a lot from today's topic, and I hope that they keep it to practice. So moving on to the next question. My next question is, can poor menstrual hygiene lead to fertility in short?
Okay. Like I said earlier, yes, poor menstrual hygiene can lead to infertility. I mentioned earlier that if a woman experiences poor menstrual hygiene, it can cause bacterial overload. Not just that, it can even also cause, there are actually some viruses, for example, Epstein-Barr virus, that one actually causes cancer. You understand? So they dwell on very, very dirty environments. You understand? For example, if a lady doesn't wash her underpants for a very long period of time, she keeps on wearing it, that can actually cause the breeding of Epstein-Barr virus, and it can cause cancer in the long run. You understand? So for bacterial infections, yes. By the time these bacterial infection stays for a long period of time, causing bacterial overload, usually when bacterial activities happen, they either whenever they finish their process of bacterial activity, most of them tend to die. So their death can cause very serious deleterious effects in the body, which can lead to toxic shock syndrome. You understand? So if this is not treated, it tends to move to pelvic inflammatory diseases, and from there it now graduates to infertility. It can cause damage to the reproductive organs if not treated in time. So that's why we advise ladies, especially not just ladies, even men, but in this case, ladies, because it's menstrual hygiene, to properly experience optimum menstrual hygiene. So, thank you.
Thank you very much for that answer. I don't want to take much of your time. Let's move on to social and psychological aspects. My question on that topic is, why do some girls stay away from school during period? Because there are some people, when they are on their period, they won't be able to go out, they won't be able to do anything. And for me, as a lady, I don't really know much about that. Can you throw more light on the reason why that's the do?
All right, thank you very much for that question. So, I know there are a number of ladies that experience excruciating pain when they're on their period. They tell you, that is so painful. Some of them even go as far as getting admitted because the pain is too much. Their pain threshold has not gotten to a very high level. So they are now very weak. Maybe they can't go to school, so they are bedridden. So that's one of the reasons. And then another reason, there are some girls that are usually ashamed to go out on their period, probably because they feel like they might get stained and people will laugh at them, calling them all sorts of names and all of that. Yes. So that's actually one of the reasons why. And then for the fact that they go to school or they go out, and then let's say the opposite gender now hears that, oh, this person is on a period, or the men will now begin to tease them that, see this one, she's on a period and all of that. They begin to laugh at her. So those are the reasons why most ladies don't go out whenever they're on their period.
Thank you so much. So, last question for that segment is, how can embarrassment or shame around menstruation lead to poor hygiene?
Okay, thank you for that question. So like I said earlier, when ladies are on their period, they tend to stay indoors. You understand? Like I said, most of them are ashamed, because they don't want people to identify that, oh, this person is on a period and all of that. You understand? So because of that shame, because of that fear, because of that stigma, they now begin to go to stay indoors. Let's say they don't have like menstrual pads at home. Because of that stigma, they wouldn't want to go outside, to get pad. Because let's say if they get to a shop now, they're like, oh, I want to buy always natural, or I want to buy tampons, and people then begin to look at them like, oh, this one is menstruating, that kind of thing. So they are now ashamed, are afraid to identify that, oh, they are menstruating. You understand? They don't want the public to know that, oh, this is what is going on with me and all of that. So that's why they tend to stay indoors. And then staying indoors now worsen the situation because they don't have the processes, or they don't have the tools to to take care of themselves. And
And
that's
even that thing.
exactly, and the pain. So that's why all of that happens.
Okay, thank you so much for that answer. Okay, let's move on to another statement that talks about access and education. It's still under for menstrual hygiene. So under this case, I'm going to be asking a very funny question to the men because it concerns the men and guys. So the question is, why is it important to educate boys and men about menstruation too? Because the men or the boys will say, what is our own? Are we ladies? Are we doing period? Why should we know about it? Because then I could remember that when I was in school, let me say in my GSS 1 or 2, then they always come to schools to educate girls, and they will just come to the class and say, all ladies come to this place, the guys stay in your class, that kind of thing. And it's meant to be a general topic for both girls and boys, but they separated the guys. And today when you talk about something like, the men will like, what concern me, am I doing period? But from this question, say, why is it important to educate both boys and men on menstruation?
Okay, thank you very much for that question. For the fact that we as guys we don't experience menstruation, it doesn't mean that we don't have a role to play in that aspect. Take for example now, if let's say a lady now or a 13-year-old or 12-year-old now begins to see her menses. That's the age whereby they begin to see their menses. And then the boys around begin to mock them like, oh, see this one now, blood is coming out from her, vagina and all of that, that she's peeing or she's pooing and all that. Because in that first stage, it's a whole lot of experience for the ladies. You understand? So the men need to know how to they need to know how to go about the whole process. A guy shouldn't mock a lady because she's menstruating. It can dampen her mental health. You understand? It can give her that sense of shame, that going forward, oh, she's not meant to, you know, tell people that, oh, she's on a period, so that they know what to do. You understand? She's going to be locked up in her shell. Whenever she's supposed to go out there to maybe buy sanitary pad, she prefers to be locked up in her room, to stay in one place and all that, which is not supposed to be so. You understand? But then again, boys and men are supposed to encourage women to experience a very good
Menstrual
menstrual hygiene. Advise them to change their pads often. Advise them on the kind of foods to eat because there are some certain kind of foods that increases bleeding and causes pain. So you understand. So you tell them, like for example, now spinach. Spinach tends to increase bleeding time. So it's part of the things that men should know that, oh, this lady shouldn't eat so and so. If they want to eat vegetables, she shouldn't go for spinach. She can go for maybe ugu leaf or any other broccoli or any other vegetable that is healthy that can um, reduce or that can something that wouldn't aggravate the bleeding and the pain. So this is why it's important for men to actually be educated on menstrual hygiene.
Okay, I hope our boys and our men are taking note of this idea that you don't leave the menstrual issue for the ladies or your sisters at home, because you may say that I'm not married, but you still have a younger one or a sister. When they are feeling those pains, you have to be there for them and encourage them. Moving on to the last question before we wrap up the show, we are going to be talking about the best practice to use for increasing the better hygiene. So the first question is, what are the three things that you can do to ensure a good menstrual hygiene every month?
Okay, thank you very much for that question. So, for you to ensure a good menstrual hygiene, first of all, like I've mentioned in the previous parts, you need to get a very good sanitary pad, one that can actually hold for a period of time. Then you can also get tampons, to clean tampons from trusted brands, trusted companies that can properly absorb the blood coming from the vagina, you know, and then the time it takes for a lady to change her pad should be every 6 hours, and it shouldn't be every 24 hours as people in the public usually do. You know. And then you eat good food, you take good supplements. This will actually help to give you, this will help you to experience optimum menstrual hygiene.
I hope you enjoy our talk. Stay tuned. You can comment, share, and like, and also subscribe to our channel for more interesting topics coming your way next time. See you when we come your way again. Your health is our concern. Bye. Now.